So this next mnemonic is to help you remember something related to dementia. So basically, when you're assessing a patient for dementia, it's really important to ensure that one of the following listed conditions isn't an underlying cause for the dementia symptoms. You want to make sure it truly is dementia. So if you can imagine the word dementia down the left side of your paper, spelled it out, DEMENTIA. And so you want to make sure they don't have problems with D, drugs and alcohol, E, eyes and ears, M, metabolic and endocrine disorders, E, emotional disorders, N, neurologic disorders, T, tumors and trauma, I, infection, or A, arteriovascular disease. So you want to make sure that you're assessing your patient to make sure none of these underlying reasons can be the cause for their symptoms that seem to be dementia. You want to make sure it's not one of those things before you're looking at a dementia diagnosis. So again, it's dementia. D, drugs and alcohol. E, eyes and ears. M, metabolic and endocrine disorders. E, emotional disorders. N, neurologic disorders. T, tumors and trauma. I, infection. And A, arteriovascular disease. You also want to assess with your patients with dementia for changes. So the way that you can assess for changes in them is with the acronym or the mnemonic JAMCO, JAMCO. Older people like jam in the company of others. So JAMCO. Older people like jam in the company of others. So J, judgment. Can a patient determine the outcome of a choice, or are they having difficulty assessing the risk of that choice? A, affect. Are they having a problem with the ability to express feelings or emotions? M, memory. You want to assess their short and long-term memory with various different ways, asking them to remember words, maybe the date or something going on today versus what was going on 20 years ago, or what is your kid's name, or, like things like that. C, cognition, the ability to process and relate information. And O, orientation. Ask if they're oriented to person, place, and time. And it's really important that you understand their baseline while you're assessing for changes, because everyone with dementia, their baseline is not going to be the same. So those are a couple ways that you can assess for changes in a patient with dementia. And again, it's JAMCO, JAMCO. Older people like jam in the company of others.
This has been another episode of the Nursing Mnemonics podcast by NRSNG.com with your host, Katie Kleber, RN, CCRN. To grab all of our nursing cheat sheets, head over to NRSNG.com/freebies. That's NRSNG.com/freebies. Thank you so much for being here today. We love you guys. We thank you so much. We want to see you guys succeed. Listen, we're all in this together. Now go out and be your best self today. Happy nursing.